Okay, I'm really pleased to welcome you all to this webinar, this student engagement event. It's just wonderful to see how many people have joined and the different range of professional groups and the different stages of career that people are at. Now, I'm going to introduce myself whilst I give people the opportunity to continue to join. Some of you will know me, some of you will not. So I'm Catherine Robinson, Professor of Social Care Research at the University of Manchester, and I'm involved in a number of NIHR things, which is why some of you may have seen me before. So I'm part of the Greater Manchester patient safety collaboration. And I'm also part of the NIHR Research Support Service Specialist Centre for Social Care Research. And I've joined also the team of the Applied Research Collaboration, the Thames Valley one, which will be starting in April. So I've been involved in NIHR stuff for a while, and hopefully that will make it useful in terms of the Q&A session. So just to say a little bit about the Q&A session. You will note at the bottom of your screen that there is a Q&A button. So we would like you to use that to put in any questions that you might have for panel members, and I will introduce panel members in a moment. Now you can upvote a question, which will be helpful for us to gauge the questions that have got priority. Now, if we run out of time, then we will pick up the questions afterwards. So don't worry that questions will remain unanswered. We will follow up with that. Now, this is also possible to have a live transcript of the proceedings. So if you choose live transcript and say show subtitles, then you should be able to see the live transcript going forward. So if we run out of time, don't worry, we will continue. Now, I'd be really pleased to introduce you to the panel members, and I wonder if panel members could turn their cameras on temporarily. So I can see Mike. Who else can I see? Okay, so I'm going to introduce you to all of them. Now, Paul Clarkson, Dr. Paul Clarkson from the University of Manchester, he's a senior lecturer there, isn't on the programme, but Paul's joining us because although I'm not in outer space, I am quite far away. I'm overseas in India at the moment. And so Paul is going to be my stand-in if I suddenly disappear. So thank you, Paul, for joining us, and Paul will get involved in the Q&A later as well. Thank you. And then Dr. Mike Clark, who's from London School of Economics. He's a professorial research fellow there. So again, welcome, Mike. And Dr. Katrina Forsyth, who's a senior research fellow at the University of Manchester. So thanks for joining us, Katrina. And Katie Cleese, who is a pre-doctoral research fellow and a social worker and works for the Lancashire and South Cumbria NHS Trust. Welcome, Katie. So you'll be hearing from three people later and Paul as well. So thank you. So, okay. Next slide, please. Next slide, please. So I'm going to say a little bit about social care, social work research careers. And social care, it covers a wide range of topics. So if we could have the next slide. And it's got lots of different professional groups associated with it. Lots of different professionals, practitioners, social workers, occupational therapists, social care nurses, care workers, all working in the sector. and then people who need the support of social care services, carers, voluntary sector organisations are all involved in setting the agenda for research, being involved in research and leading research. And as you can see from the slide, there's a whole range of different topics. So it's important to emphasise that social care, social work research, it's mainstream. It covers the full range of research methods to answer a whole different raft of research questions about complex issues. There's a commitment to strengthening the evidence base. The professional groups that I've talked about are evidence-based professional groups and find the evidence base and research important. Now, those building blocks of the evidence base include evidence synthesis, observational studies, rich qualitative studies, ethnographies, cohort studies, and randomised controlled trials, and the economics of care. Transitions are important in social care research as well, whether that's transitions from children's services to adult services, or whether that's transitions across sectors from health to social care, from hospital to community, for example. Next slide, please. Now, surrounding us are lots of different areas of support, and a key one, and a couple of my colleagues today are involved in the Research Delivery Network, which are regionally based. Both Paul Clarkson and Katie Cleese have got leading roles in the Research Delivery Network and providing support and guidance to the teams that are providing that support. Now, it's an area where NIHR continues to develop, continues to expand the scope to help with recruitment to studies right across different sectors, including, for example, work in prisons, work in the community, work in care homes, very much health and social care. Next slide, please. Now, this slide at first glance might look quite clinical. Note the title, Clinical Trial Delivery, but it is an extract from a paper, and we've not changed it. It is as it was published. But all of these things about that participant in the middle, carer engagement, and if you just replace a patient with person, somebody who needs support, or patient, all of these things, recruitment, intervention, delivery, outcome measurement, quality assurance, they're all relevant to trials that happen in social care. So important to note that social care trials happen. There may be fewer of them, but they are important. Next slide, please. So NIHR, NIHR is the thing that's brought us all here together. Next slide, please. I mean, this is really quite a strong statement, but it's important. NIHR, it's the health and social care arm of our nation. It's wide and it's impactful. Next slide, please. Now, it funds a lot of world-leading research, and that includes world-leading research in social care as well as healthcare. Next slide, please. So it's the academy schemes are quite important in terms of funding for social care research, in particular in relation to career development. And I would go as far as to say that I would challenge an individual to find or fail to find a pathway along the research journey that they're thinking about. So there are so many different schemes that sometimes it looks quite complex. There's a complex array of funding, but actually, if you think about it, that complexity provides that comprehensive approach to opportunities, regardless of what stage of career development you're at, whether you're newly qualified in your professional role and thinking about research, whether you're new and an early career researcher working in a university, there is a scheme that will take you further along that pathway. Next slide, please. The other important thing to say about NIHR, as well as supporting career development in terms of development and training, it's inclusive. It's about being there to support people who need the support of social care services. So the research, it has got to be inclusive, both in terms of the sorts of services that are involved, people using services, people doing the research, regardless of what professional background. It's the attempt. There are some professions, for example, that are underrepresented in the research world, and NIHR is striving, and that family of NIHR infrastructure, to make that different. It's really very much about people and communities, and that's the whole community. And we're learning more about how to strengthen our inclusive research and to increase diversity, and we'll continue to learn. Next slide, please. So this gives you an example of, and these are the research delivery network figures. Actually, the total figure of people involved in research studies in health and care will be much greater than this. But it's quite an array, isn't it, right across the country. And although the figures for other bits of the UK are not shown here, the NIHR reach is really, really wide. Next slide, please. So the NIHR very much creates a network of support and expertise, and it's very much about capacity building. As well as doing that world-leading research. It's supporting people to be able to do that world-leading research. So next slide, please. Now, this is a very busy slide, and I don't want you to be put off by that. It shows the very many schemes that are available to you as an aspirant social care, social work researcher. Now, some of the individual schemes will have webinars of their own, and there's lots of online information. This is just a very brief overview. And your initial foray into research might be as an internship. And there are both specific internship schemes run by NIHR, and also some internships attached to different bits of the infrastructure. They're regularly advertised, and there's always a contact point to get more information. Then if you look a lot further along the slide, it takes you right from that initial experience right up to a chair or a senior investigator. And at each of these stages, there is support and there is funding and there is a scheme to apply for. Next slide, please. So just to say a little bit more about one of the newer schemes, which is really quite important and is aimed at and to inspire students into research. So people who've got that professional qualification and are earlier in their research career to think about going beyond that initial professional training to do a master's or to do some engagement work. It's regional. And there are places available in each region. So there are 12 insight programmes in England to deliver this innovative engagement programme and funded research masters studentships. Next slide, please. So this is the slide that tells you a little bit more about the specific internship programme that I mentioned earlier on. So next slide, please. Now, there are also some very specific opportunities for particular professional groups. And although this covers more than social care nursing, there are some specific schemes for social care nurses. Next slide, please. And this is a growing group, and it's really good to see that specific support is available for social care nurses, and there is this programme that you can find out more about. So next slide, please. And again, another particular programme that you might want to find out more about. And as I said earlier, all of these slides, too many to go into detail, but please do look at the links when you receive your copy of the slides. Next slide, please. Okay, now I want to say a little bit about support that's available to you. I think what's really, really important is that when you're embarking on those early steps, or if you're partway through and you're thinking about the next step, that you're not alone, that there is lots of support there. And NIHR has quite a big infrastructure. There are lots of different infrastructure groups. And then there's also the incubators, which are particularly aimed at professional groups or areas that are underrepresented in the NIHR portfolio. Next slide, please. So there are some bits of the infrastructure that are very much focused on social care research, and the School for Social Care Research is of course, the primary example of that. But important to note that other bits of the infrastructure, such as the patient safety collaboratives, the applied research collaborations, and indeed the biomedical research collaborations, do collaborative work, are still very relevant to social care research. So don't overlook them. They have calls for proposals. They're keen on collaborations. And the School for Social Care Research, I think, has got some calls open at the moment in terms of career development opportunities. Next slide, please. Then the incubators that I mentioned, and I'm really pleased to say that there are several incubators. And if we could have the next slide, please, that are specifically about social care, or have got a very strong social care component. The incubator that myself and Mike Clark lead, the Mental Health Social Care Incubator, is one of them. Then there's also the Acquired Brain Injury Social Care Network that's important to social care. But many of the other ones, for example, palliative and end-of-life care, the Emergency Care Incubator, and the Race Equity and Diversity and Careers Incubator, they're all very relevant to social care, and we've got collaborations with all of those incubators. So have a look, because they are very much about helping people along their career development path. Next slide, please. And that's just a visual indication of where all the different bits of infrastructure sit. And as you can see, it's right across England. Next slide, please. So how can we support you? I've mentioned lots of things already about how we can support you, but next slide, please. Now, the Research Support Service, it used to be called the Research Design Service, and it's developed over recent years. It's a national service. It's got some specialist centres. It's got two related to social care research, and some of our speakers are involved in the Lancaster and Partners-led one. It's got a public health specialist focus as well. It's really important if you want some advice, some support, pre-award, post-award delivery, that make contact with the Research Support Service, and they will help you, or they'll put you in contact with somebody who can. Next slide, please. Then if you're thinking about one of the fellowship schemes, and it's important that the focus is on fellowship schemes for this particular fund, and you need a bit more time, you need a bit more support or mentoring, then have a look at the pre-application support fund. It's really useful to give you that time, to give you that additional mentoring. So next slide, please. Okay, so I'm not going to say very much about general tips and advice because I know my colleagues are going to pick some of this up. But my general tips and advice are to remember that you're not alone, to reach out early to people who can support you. If you're going to do a fellowship and you're a practitioner, then you need to reach out to your practice organisation and to the university that you're thinking about placing your mentorship and supervisory support in. Really important to read the guidance yourself. Help get people to help you interpret it, but have a look. And then speak to NIHR. They're really helpful. The academy colleagues are really helpful. If you ask a question, they will respond to you. And keep going. That's the other important thing. If you're not quite ready for the next call that you're aiming yourself at, you know there's going to be another one. So do keep going. And if you're not successful the first time, seek some more help and support and try again. Okay, next slide, please. And the other resources that are available will be on the slides, so please have a look at them. Next slide, please. And if you could just keep running through those slides because they will be available online. Okay, now I'm absolutely delighted to be able to pass you over to our first keynote speaker, and that's Dr. Michael Clark. So without further ado, I'm just going to pass you over, Mike.
Thank you, Catherine. Good morning, everyone. It's lovely to have the opportunity to talk to you today. Hopefully you'll find this interesting and helpful. Next slide, please. So I'm Mike Clark, and I'm based, as Catherine said, at the London School of Economics, and I do research across a range of topics, social care, but also the interface with issues around mental health, dementia, homelessness, head injuries. So you can see that social care is relevant to a whole host of issues in society and people's lives. And I've started this presentation with this quote from Albert Einstein. You can't go wrong if you quote Einstein. If we knew what it was we were doing, it would not be called research, would it? So it's interesting, isn't it? Usually you think of going to professionals and professional careers as about knowing the answers. You don't think about professionals starting from I don't know. But that's what research is about. You start from I don't know what the answer is, but I do know a lot about how to get the answers. And that for me is one of the things that just makes research so interesting, is that you're starting from that position of I don't know and you're trying to find something out. Next slide, please. And if you think about the complexity of society, there's an awful lot of things out there that we don't know. We're trying to understand people's lives. How can we best help people who are street homeless? How can we help people who have had major brain injuries after they've been released from discharged from hospital and are looking to rebuild their lives? How can we best help community and charity organisations to help people in their communities who've got mental health problems? These are all the kinds of questions that come up in the work that I do, and the conversations that I have with people in communities and practitioners. And then what we're trying to do is understand people's lives, which is just an absolute privilege when people let you into their lives and talk to you about those lives and the problems they have and the joys and the love and the frustrations. It's just a real privilege finding out about people's lives. And then we're trying to use that information to make society and people's lives better. Next slide, please. So what we're trying to do is, this means addressing puzzles in that gap between understanding people's lives and then how can we use that information, how can we analyse that data to then answer the questions about how we improve society. That means addressing puzzles, and that's what's really interesting for me about research, is trying to solve those puzzles to help people live better lives. Next slide, please. And there are lots of interesting ways to try and solve those puzzles. We all do an awful lot of public involvement, sitting down with people with lived experience of issues or from particular communities to talk to them about what are the research priorities that they experience, what are the things that they'd like to have answered, how could things, particularly services, better improve their lives. So sitting down with members of the public to learn from them about what's important. But equally, practitioners, people working in social care, they have their own understanding of priorities and issues. So we sit down and talk with them about what are the issues that they'd like researching, and then engaging them in developing the projects and working alongside researchers to deliver the project along with members of the public and people with lived experience. But then, as I said, we're trying to improve society. So all the way through the process, we have to engage decision makers so that they're ready for the information that we provide from the research, and that they're giving their views on what they would find as useful. So that could be national policy makers at the Department of Health and Social Care. It could be people in local councils that commission services. They all need to be ready to take up the evidence that we're generating in the projects. So we have to engage them as well. And of course, there's a huge range of different methods that we can use. Catherine's mentioned doing research trials where we compare one intervention against another. We may do interviews, focus groups. There's a whole range of different methods, and the puzzle is fitting those methods to the issue that we're trying to answer, the question that we're trying to answer. How do I best answer that question to make the difference in improving society? What are the methods that are going to help me do that? Next slide, please. So I want to talk a little bit briefly about an example of a project, which is the Involved project that I'm working on with colleagues from the University of Wolverhampton and community groups across Sandwell and Wolverhampton in the West Midlands, and particularly people from different South Asian communities and Black African and African Caribbean communities in those areas. And what we wanted to do was to ask them about what, as people in your communities maybe developing dementia, what would help them to live better lives and to have a greater sense of belonging in their communities. Next slide, please. So the way we did this was we organised these participatory workshops, and you'll see a couple of photos there from those workshops. So the one on the left is from a South Asian workshop that we did, and we were getting between 30 and 70 people in these workshops, and we asked them all to sit around the tables and just sit and talk, but to create these drawings or posters around a number of activities. What makes them happy? What would they like to see in their communities to help them live more fulfilling lives if they were developing dementia, or some of the people in the room actually had dementia. And you can see that in the picture on the left, the young lad there, Josh, who's poking his head in, it was great that he was working with that group of Asian ladies, and they were teasing him about something, I don't know what, but he would just turn the brightest colour of red every few minutes in the workshop. And a lot of the time I had no idea what was happening in those workshops, partly because there were so many different languages being spoken and I just didn't know what was being said. But there's just such a brilliant energy in the room, and I thought this is really working. People are engaged in this, telling us about their lives, their communities, and what they really want to have happen to help them live happy lives in their communities. Next slide, please. And now what we've been able to do is we've taken all of their drawings and we worked with an artist who's done this illustration for us. So this is a composite of the various drawings that were done in all those workshops and all those groups in those workshops, about people's community, what they said they would like. And we were able to use this now to go to a number of decision makers in the local authorities, policy makers, and start talking to them about the issues that people raised in the workshop. So one of the issues, for instance, is that yes, people did talk about services. So you will see a hospital on there and ambulances and the GP surgery is on there, but they're not central. They're on the edge of the drawing. People didn't want them to be central to their lives. Even if they were developing dementia, they didn't want their whole lives to then become oriented purely around going from one hospital appointment or doctor's appointment to another one. They wanted to carry on doing the activities that they'd been doing for years, going to the local cafes and shops and markets and visiting friends. And the other thing that we're pointing out from this is that you can't identify one building in this illustration that is community. So sometimes I think people naively think that people from certain communities, you may go to, say, a place of worship and that is their community. But what people were saying to us was that yes, a place of worship may be important in their week, but it's not their whole sense of community and place. And so what we're able to do is to go along to local decision makers and say, this is the complexity of communities in your area, and people want support across all of this to be able to live healthy, fulfilling lives, even if they're developing dementia. And so we're able to help then policymakers to avoid any naive assumptions, such as that maybe they just go to a local temple and they put more information about dementia there, and that's doing community care. Next slide, please. So that's it from me. I'm just finishing again with a quote from Einstein. We can't solve today's problems with the mentality that created them. So that for me is research. What we're trying to do is to solve today's problems by creating a different outlook, putting together the evidence and the ideas to find new solutions to help people. Hopefully that's been of interest to you. And now I think I'm going to hand back to Catherine.
Yeah, thanks so much for that, Mike. That was really interesting. It really helped bring alive research. So thank you for that. So now I'm going to pass to Katrina. So over to you.
Thank you very much, Catherine, and great to hear from Mike as well about your insights. So my name's Katrina. I'm a senior research fellow at the University of Manchester within social care and society. My area has largely focused on the health and social care needs of older adults living in prison and also social care more broadly within the criminal justice system. And I'm going to tell you a little bit about the key issues that are really important to me, that mean that I've enjoyed my career so far within research. Next slide, thanks. And again. So for me, and Mike touched on this as well, which is interesting, I really enjoy the problem-solving nature of research. And I was just reflecting back, and I can remember quite distinctly being in A-level sociology classes and really getting a buzz from the problem-solving aspect of research. So thinking about what methods could you involve, what could you use to answer specific questions? What are the advantages of that? What are the disadvantages of that? So then it was thinking about questionnaires or interviews. And I knew that I got a buzz from this instantly. And I knew that this problem solving nature was something that I really enjoyed. And that might be something that you're able to reflect on different elements of research or your careers that really feel good. And I think it's important to recognize that. And I think this is really sort of been the foundation to leading me to really enjoy and be geekily into different research methods. And as time's gone on, I've started to develop myself as a research methodologist, as well as having a particular focus on social care in the criminal justice system. Next slide, please. For me, what's also really important as part of my career in research is autonomy. Maybe I'm a bit awkward, I don't know. But for me, to be able to design the studies I want to design, to get the research funding for the projects that I want to, don't get me wrong, very much in collaboration with colleagues, but being able to follow your passions and what really interests you is crucial for me to make a research career interesting and important and keep you motivated through those long days and tough times. So I have a lot of flexibility within my role as a senior research fellow. So there might be a 3-year project or a 5-year project or a 6-month project, and I have to determine how I get to the end of that project. But how I get there is very flexible and up to me, and that can be, a positive thing and a negative thing. There's importance in terms of managing your time, but it gives you that flexibility and autonomy and to work in a way that works for you. You might work collaboratively, you might work in isolation, you might work at home, you might work in the office. That autonomy to be able to do something that interests me in a flexible way is really important. That does come with certain element of job insecurity sometimes because I'm always reliant on pretty much getting my own funding in. But for me, that's never been an issue because I enjoy it so much, like the aspect of getting in funding and problem solving. But there's challenges with that as well. Next slide, please. Also, I think it's really important to consider here about opportunities. So, since the NIHR expanded to become the National Institute of Health and Care Research, the opportunities for social care research and also social work research really have genuinely been there. So, it isn't just a paying lip service to career development. There really is opportunities for people who want to develop research careers within social care, within social work research. In a way, that's partly as I started to specialise a bit more in social care research because I'd looked at health and social care research quite broadly within the criminal justice system. And I then applied for a career development award, which was looking partly about developing a funding bid around dementia in prison and developing services for people with dementia in prison. And that career development award kind of pulled me into the social care arena more. There's a lot of opportunities for these types of awards, which Catherine has alluded to. They're perhaps, dare I say, a little bit less competitive than some of the health ones. So that's an opportunity there, as well as having lots of support. Also, moving and leaning more towards social care research has given me a really interesting framework to draw upon. So, thinking about how those important, interesting topics fit within the care work, for example, the Care Act. So, some of my work that I do is around social care in prison, looking at how peer and buddies develop services within prison. And so, being able to frame that within the social care legislation has been really, really helpful. Thank you. Next slide. But I think perhaps most importantly for me, a career in research has allowed me to consider how I make a difference and how everybody I work with makes a difference. And Mike's talked about the really valuable work he's done in relation to some working with individuals with lived experience. And that certainly is one of the parts of my job that I really, really enjoy. It really brings it to life. For example, when we're talking about social care in prison, talking to individuals within our lived experience group, how they go to prison and they're traumatized by their previous experiences, and then having to provide social care for other prisoners. Until you hear that from individuals with lived experience, you can't really understand what that's like. So I really enjoyed that aspect of my work and thinking about how you make a difference at different levels. I think the first interview I ever did with an individual living in prison, I can imagine it was, the first time you go into prison, it's going to be a bit daunting. And the individual told me that they were going to kill themselves and take someone else with them. And that was my first interview in prison. But actually, I followed that individual up in the community. And because we'd got involved and got support for them, that individual was very grateful and happy and felt very well supported. So at an individual level with participants or individuals with lived experience, there's that opportunity to make a difference. But more recently, I found as I've developed a kind of niche specialist area in relation to social care in prison, I've had opportunities to really get involved at a policy level. I've had some funding opportunities for that specifically relate to policy, and now I sit on the Ministry of Justice steering group for developing an ageing prisoner national framework policy. And so being able to get involved and actually create meaning behind the work that you've been doing has been exceptionally interesting and rewarding. Yeah, so I think that's me. That's some insights into why I really enjoy my career in so far in research and social care. Thank you.
Thanks very much, Katrina, and it's really good to hear those positive comments about change and increasing opportunities. That's really good. Thank you.
Thank
So
you.
I'm going to hand over now to Katie.
Thanks, Catherine. I don't know I'm going to follow them too, but I'll give it a go anyway. I'm definitely much more the start of my career phase. So I'm Katie Cleese. I'm a social worker by background, a research lead for Lancashire South Cumbria NHS Trust, community settings lead for the Regional Research Delivery Network, and currently on a NIHR pre-doctoral fellowship for 12 months. Next slide, please. And that exactly says the same thing, just with some logos and with my email address, if anybody wants to contact afterwards. Next slide, please. So this is a little bit about how I got into research. So like I say, I was a social worker. I had no intention of ever getting into research. I'd done a literature review at university and wasn't particularly interested in getting involved in stuff. I'd done a very small research project as part of my undergraduate in social policy and sociology, which was interviewing women with disabilities about how that impacted the view of themselves. And I was interested in it, but it was quite a small part of it. And then, like I said, I did the literature review for my masters, and yes, I loved the learning out of it, but the reading of loads of stuff and not actually having any time with people, just looking at stuff, I thought that's not for me. And then I came into social work and I got an opportunity through the trust. There was a funded small scale practitioner evaluation programme. And I got on that and I met a wonderful professor, Aidan Worsley, for those of you who know him, and he mentored me through a 6-month practitioner research programme, half a day a month we spent learning about stuff, we had mentoring, and I was able to look at what the impact was of my job role, which at the time was mental health practitioner, within the children's social care family safeguarding services by interviewing the colleagues and people who received those services, and it did lead to a change in practice and a change in the team. And I thought, it's actually all right, this research stuff, because you get to speak to people and get to change things. So that's what sparked my original interest. And then my boss applied for some capacity building money from the NIHR and created a research lead for social work. With a big part of it was try and get social workers interested in research, because generally, as social workers, those who do research sit in universities and those who don't go out and see people. And quite a fast pace of work. And although we understand that there needs to be reasons for why we work with people in the way we do, we get very little time to engage with research. And for those colleagues in the local authority, they don't get opportunity to get hold of research because they don't have access to academic libraries unless they're undertaking a course with the university. We're a bit better really in the NHS because we can get hold of some of that stuff. So some of the ways I built capacity was get a social work research forum going. We run an annual conference, social work research, doing the practitioner programs that I went through. I now co-lead on it, and doing some knowledge synthesis work. NHS England then funded me to do some research engagement work, and that was with communities that were unheard in research. And it was brilliant because, again, I got to go out, work with some different groups. They co-designed with me how they thought groups should be engaged and taught about research. It was very much like, we've got some money, what do we do with it? And it came from within, and because it came from within, it's quite powerful when working with other groups. And the people from the original engagement group in the community, they were able to then lead on future event programs and train more social workers. So we've got quite a lot of social workers and community members doing that now. And then I found out about Catherine Robinson and her team and the Mental Health Social Care Incubator, the Stepping Into Research programme. And it was great because I met loads of people that you've heard from already and other people who were dead experienced in research. And the things that both Mike and Katrina have talked about, how research is dead exciting actually, and how you can really hear from people and work with people. And I was even more fired up for it. And I got to go through the programme, and I got loads of support in writing my pre-doctoral fellowship, which, as you know, I'm now on. And then since then, I've had help to write my doctoral fellowship as well, which I've really appreciated. I've been able to write some stuff and get published, and a couple of times people have contacted me to tell me they've cited my stuff, which is the most exciting thing I've ever heard in my life. Cleese 2025, I feel like I've made it with that. So I don't know, people that are further on have done that lots, but for me, early on, I'm really, really excited by that. And I've been able to be co-applicant on other grants, and again, take part in some bigger research stuff with some really experienced people that mentor me through that. So I'm lucky in that. Next slide, please. So, in terms of it, some of my social work friends say to me, this is the glamorous side of social work. And I think when they see me going off to conferences or having time to read things, they think, wow, that's really different from, being out on the front line and doing stuff. And yeah, I am. I'm dead lucky. I get to go to some really good stuff, and it's brilliant. But on the other side, I definitely don't want to be in a glamorous side of social work. I want to go out and talk to people. I want to help to empower people through research to make change. And I think definitely since I've been doing this sort of work over the last 2 years, I feel more confident and more like I belong in a research space, because before I came into it, I very much thought that's for dead clever people, that's for academics, that's not for people like me. And it is like, it's daunting because it's got different language, different acronyms. And like I said, there's this held belief that actually we as social workers, we're not academics, although social work is a degree qualified profession. I think it's just a bit of a cultural thing. But again, looking at research, social work skills do matter in research. The experience I've got is relevant to research. Being able to build networks and maintain them draws in your social work skills, but actually, again, having time to go out and get networks that are local, regional, national, being able to reach out to people and say, oh, your subject's dead interesting, I want to do stuff like that, and learn from people. And everyone has been so helpful and so friendly. So all these like academic types that I thought were way above me and, really, really clever and everything else, they might be all those things, but they are so lovely. Such a nice breed of people, these research lot, and I've really enjoyed getting to do all that. And in terms of impact as well, being able to get communities involved, being able to have time to do that co-production, that means really becoming friends with people, becoming equals, becoming colleagues, that you can't do in social work. You can't make friends with people that you're offering social care interventions to, and it wouldn't be appropriate. So sort of changing my narrative of how I am as a social worker and being able to do that kind of work has been brilliant. And also being able to lead others now through my experience, helping other people. And it feels like actually I have learned an awful lot, and there's something there to be able to give back to other practitioners in that continuing, evolving cycle of practitioner research. Next slide, please. Okay, so some of my highlights, obviously securing the pre-doctoral fellowship, to be able to be bought out of your job for a year, to be able to do the career training that you want to do is really, really privileging, and really happy to be on that. And I've got a brilliant mentor team, the absolute best. So again, I feel in really safe hands. I've got people that will challenge me, but will absolutely develop me and spend loads of time on that career development. And I am in a really lucky position for that. I've been able to form an advisory group who, again, really wonderful people, and it's really meaningful, a real mix of people coming together, but everybody is valued in that space. I've won some awards, so I've won a mentoring award, a capacity building award, and a Rising Star award, and also been shortlisted as a finalist twice in the Social Worker of the Year awards, but so far no prize in that. I have to keep trying. And some of the other highlights, so when we first started doing this research engagement, a wonderful woman called Ivy stood up and said, look, research is a relationship, it's not a one-night stand. And I think absolutely that's the things that we miss sometimes, isn't it? The relationships between the researched and the researchers. So that's been really important for me. And when I talked about breaking down barriers before, somebody that I'd worked with, who I'd engaged with, a community member, who I suppose from stuff going on in her life had quite a lot of guilt and shame around things that had gone on for her. And we met somewhere and I said, oh, this is my colleague, blah, blah, blah. And she said afterwards, I felt really validated, actually, that you didn't say I was a service user or whatever. You referred to me as a colleague, which she is. So I have a lot of hope at the minute. So I applied for my doctoral, and I don't know whether I'll get that or not, but I'd really like to. And I'm doing research on a problem I've been talking about for 20 years, and I've been ranting about and saying, why is nothing being done in this space? And actually now, hopefully I'm going to get to do something in this space. And the other highlights are the colleagues and the networks I've built through this. It's been an absolutely amazing journey over the last couple of years. Next slide. I'm not sure if I've got a next slide. Oh yeah, future plans. So hopefully get on the doctoral fellowship and then get on a postdoc award to continue to do not just doing research, but actually embedding things and making change, and keep pushing that social work agenda within research. And I think that's the last one. Oh no, it's not. I should have looked at this before a bit more, haven't I? So recommendations for people who are thinking about coming into research or applying for awards: really read the guidance, because it's helpful and it tells you exactly what's needed from there. Take all the help offered. So if there's webinars, if there's programs like Stepping Into Research, if there's any local practitioner research programs you can do, colleagues who are experienced, mentors, they're all absolutely instrumental in changing. So definitely take everything that's offered. Consider what you're going to do, consult with other people, plan, consult again, refine it, consult again, refine it, and keep going until you're really happy with it. It's never going to be perfect, but you want to be happy with it and you want it to be good, especially if you're going after competitive funding. Don't leave it till the last minute. So I was on the first round of this pre-doc, the systems had changed, and suddenly people had to sign up even though they previously had accounts, and that was stressful. Things like getting your costings, getting your letters of support, don't leave, it's your priority, but it's not other people's. So you really need to get it in advance. And I quite often tell people that deadlines are before they are, for that very reason. And make it yours. Do research because it means something to you, not because it's like for research sake, but actually something you are passionate about, because it's hard, it's frustrating at times, but also what a wonderful thing to be able to work on something you really genuinely care about. And now I think we're at the end. There you go. Thank you.
Thank you, Katie. That was really informative, and your advice really excellent. And you've got so recently gone through these processes. It's really helpful. So thank you. So it's Q&A now. So I would encourage people to put things in the Q&A if you've got questions. And we do have some. And hang on. Okay, so Josephine's question about whether or not NIHR Academy fund professional doctorates, and I'm sure a colleague will correct me if I'm wrong, but at the moment professional doctorates are not part of the Academy doctoral funding scheme. Would anyone like to add to that response from me? Okay. But Josephine, if you'd like to reach out to one of the incubators or to the Research Support Service to talk about your plans in more depth, then please do. So Nazia is asking about workplace high pressures, structural disparities, and has contacted a number of academics, but has not had replies. Katrina, could you pick this one up, please?
Thanks, Catherine. Sorry, I'm just trying to make my way through it. I think talk to people, like start rather sometimes emailing people directly. It can be challenging, and we know how limited time everybody has. But start with talking to people, perhaps. So talk to the Research Support Service, who can link you with other individuals. That would probably be a good place to start. Just trying to get your particular area. Look for people who have recently published. You can contact them directly as well in this area. But it sounds where you are, Research Support Service would be a great place to start.
Thank you,
Catherine, is that
Katrina.
add in? Nazir has said that they've contacted some academics and had no replies. I'm sorry to hear that. Most academics, in my experience, tend to welcome emails from colleagues like yourself about research ideas. Academics are always looking for the next ideas to work on. So I'm sorry you've been particularly unlucky, I think. I think, as Katrina said, the Research Support Service may be able to put you directly in touch with people. And then if you haven't already, there's a team at King's College London that do health and social care workforce research. Perhaps have a look at their website and see if there's anyone there that might that you can reach out to and who might help you talk through some of this.
Yeah, thanks for that, Mike. That's really helpful. And Nazia, I know that you've done a little bit more detail in your next question, but I think we've now covered that. But please flag if we've not responded to that in enough detail. So I can move to Jack's question. And Katie, I'm going to pass this one to you because he's keen to know more about your annual conference.
Yeah, hiya. So it's a social work research conference that we run and fund through our NHS trust. And generally, it's social workers at different stages of the research career that come and present what work they've been doing, whether that's a small scale thing or a larger grant. And then also people in the social care space will come and present what things they've done, or things like what opportunities are available. So if you want to go on the mailing list, we have a research distribution list, and then I can put you on that and we'll send out absolutely everything, which you may or may not want, but it means you will be on it for when the conference is announced and when you can apply for it for this year's. It's usually in December, and also I'm on LinkedIn and I'll always advertise it on there as well.
Thanks for that. Nova's asking about shifting topic to some extent. And I wonder, Paul, if you could pick that up, although Nova refers to an interest in prison research. So, Katrina, you may want to add to Paul's response.
Thanks, Catherine. Yeah, great question. I think the essence here is gather people around you, gather a research team around you. And as Mike said earlier, the Research Support Service do field queries about, I'm just starting off, I want to share where to go, could you help me build a team? And they can put you in touch with other networks of researchers. So I would say do that first, contact the RSS, just try to build teams around you. You can co-lead research as well as lead research, so you could perhaps co-lead research with people more experienced in a different area to you to get in there. I think I'll pass you to Katrina if she's got anything to say about her side.
Thanks, Paul. Yeah, if you have an interest in prison research, feel free to contact me directly and we can discuss who might be an appropriate person to support you in your particular area. Yeah, feel free to do that.
Thank you. Somebody's asking about connections in Scotland, working in social care research in Scotland or with care at home services. Paul, is this something that you could pick up?
Yeah, thanks, Catherine. I don't currently work with anybody in Scotland, but if by care at home services you mean home care services, there's a real impetus for home care research now. It's quite an undervalued area. So I would say contact me. I'll put my email in the questions if I can do that. Contact me and I can introduce you to a few people.
Okay, thanks for that, Paul. So we've had a question about whether or not you can undertake PhDs part-time and whether NIHR funding supports that. And yes, they do. They do support part-time PhDs. Also, if you're a practitioner, if, for example, if you're a social worker, then you can also do the fellowship full-time, but it covers you and allows you to do 20%. Or a percentage of your time remaining in practice, although the full your full salary is covered. So yes, there are part-time options. I hope that's helpful. There were some questions that came in the chat that I don't think have made it over to the Q&A, so I don't want to forget about those. Somebody's asking about support for people who are working in Wales. Now, some of the programmes do include people in Wales. The academy programmes, a lot of them don't include funding for people who are working in practice in Wales, for example. But it's really important. These things do change. They don't remain static. It's really important that you look at the particular scheme to see whether or not Wales is included. But in terms of, for example, research support service support, if you've got a collaborator in England, then yes, the research support service will provide you with advice and support. And I'm also pleased to say that the call for incubators, new incubators, includes Wales. That those new incubators will be collaborations between England and Wales. So I think that's also really quite positive. And then somebody else has asked about PhDs and advice about sustainable research. So I hope I've not misunderstood the question, but I know that Research Support Service have got people who've got particular interest in sustainable research. And the Lancaster and Partners group. So have a look at their connection or their link on the RSS website and mention sustainability, and they will be able to help you. Now, if you're talking about sustainable development goals, then again, talk to Research Support Service in the first instance. So I hope that's helpful. Now I'm going to go back to the Q&A. So having a research lead within adult social care sounds exciting. Could I ask, so that's at Kate, addressed to Katie. How did that come about? And are there any other models of it being done elsewhere? I'll start with Katie and then I'll pass to Mike.
Sorry, was the beginning bit having a social work research lead? Is that what the...
Yeah.
Yeah. So I think that came off a vision. So my boss, Ryan, who's a senior research fellow at Manchester and has done quite a lot of work with Catherine, he was looking at how to get social workers involved with research and knowing some of the barriers. So he applied for the Social Care Capacity Building Award through the NIHR. And when the award was given, he used that award to fund me for 12 months with the primary aim of building research capacity. And in the meantime, I applied for quite a few grants, which meant that that role was extended, and we're now looking at the NHS Trust funding it as a standard role anyway. And we have 260 social workers. Now, what I find is it's very hit and miss with our local authorities, and again, because the research infrastructure is a barrier. So we have things like an R&D department, so they understand research within the NHS. Local authorities don't have that. We have a library service that we can access academic papers through. Local authorities don't have that, and also the pressures are different on the two. So because it's very much expected that research happens within NHS, because lots of our health colleagues do it as standard and part of their revalidations and things, although Social Work England expects you to do research and embed it, it's not kind of given the same value, I think, and not given the same expectations. I do quite a lot with my local and local authorities to look at how they can do more around research, and there is slowly a growing interest. But things like being bought out for a year to do a pre-doctoral, they're less keen, because then when they put out a post for a year for someone to backfill, they know that they might not get that backfill, and then what does that do to to their team and their resources. So there are lots of barriers that are difficult, but awards like the SSCR can fund posts like this to start changing that work. And then, of course, things like your pre-doc, your doctoral, give opportunities. I'm not aware of anything else, of any other research lead post, for example, but there are things like the impact programs that can be funded for and allow different organisations, including the third sector, to do and embed research within those.
Thanks, Katie. Mike, would you like to add to that? Because I know there are leadership roles, research champions, and so on in other organisations. Would you like to say something about that?
Yeah, I mean, as ever, there's not a lot to add after Katie's answered. So well done, Katie. Um, as Katie said, in the NHS, these dual roles, clinical academics, are much more common, where people spend part of their week working as an academic and partly continuing in practice. Social care is gradually catching up with this idea, and there are a few people out there now, such as Katie, but we know of other people that are developing this route now, where they're combining an academic role with continuing in their social care practice. And in fact, through the mental health social care incubator that Catherine and I run, and she mentioned earlier, we've supported a few people now to start to develop this, and the School of Social Care Research has had funding streams. So there are people out there. The opportunities to learn from these people and see how they've done it, see how they've overcome all the barriers that Katie's identified. That opportunity is there now, so we can put you in touch with people. And then, as Katie said, the funding opportunities are continuing to open up. All the academy ones that you've heard about as well. You know, they really do encourage and support people to continue to develop that practice and academic role. So the opportunities are out there. As ever, it's about finding the right support and guidance to help you navigate what's quite a complicated pathway.
Thank you. Thanks for that, Mike. So the next question, what would be the process if a practicing social worker wished to join the career in research? So, I mean, to go back to some of the things that various speakers have mentioned, it's about reaching out to the relevant organisations. And of course, part of that is going to be the organisation that you work in. Also, to reach out to the academic organisation that you want to collaborate with. And then if you're seeking funding to do that, maybe you're interested in doing the higher degree, one of the fellowships would be to reach out to Research Support Service or one of the incubators to get some further advice. It's a journey, and it isn't always a quick journey. I think you'll have heard from each of the speakers. There are different paths. It's not a straight path, and it's not a flat road. But please do reach out to Research Support Service or to one of the incubators. I hope that's helpful. Then the next question relates to sitting outside the conventional academic research route and having an interest in the role of education professionals in diagnosis of neurodiversity in primary age pupils in the UK. But we're very much about doing something collaborative with social care and local authority partners. And I'm going to pass to Mike to respond to that one.
Thanks, Catherine. Yeah, the good thing is NIHR supports social care research with young people and children, so that's good. I think that would include this. I think, again, as ever, it's about finding the right people to advise you and to help you build that research team, as Paul said earlier. No research project is an individual endeavour. We bring together a range of expertise in our projects, whether that be about the actual context of practice and people's lives, or about particular research methods. And invariably there's a combination of methods. So you might have somebody that knows about qualitative research, somebody that knows about doing quantitative research, all involved in the same project. So you need to build that team to answer what are usually very complicated questions. I think the RSS has had a lot of plugs today. I'd go to the RSS and say, this is what I'm interested in. They will help you get started on this pathway. I think, as Catherine said, but be expecting a longer pathway than maybe you're thinking of at the moment. I think very often when through the incubator, for instance, we start talking to people in practice and they come to us and say, I'm interested in research, and they see this huge problem and they want to solve it all in 6 months with one research project. And that's not the reality of how it goes. So expect that it will take a little while to build up support and to get going. But it's just, as you've heard from other presenters, it's just a really exciting journey once you get going on it.
Sure. And I mean, I think Mike's being shy. I'd reach out to the mental health social care incubator as well. I'm sure they would be helpful with that one. Okay, and then the next one. Do you think an internship experience before a potential PhD could be helpful? Oh, it's jumped. Sorry. In better understanding whether this is the path I want to take. I'm very interested in the field of neurodegenerative diseases. Do you know of any groups I could contact? Paul, could you pick this one up, please?
Thanks, Catherine. Yeah, I think definitely an internship to give yourself a flavour of what research might involve and the journey that you're about to take, as Mike's just said, that would be definitely a great way in before you consider PhD. I don't know any groups that you could contact. I don't know whether Mike you do in that area.
Um, Neurodegenerative disease. I mean, I don't know. We could have a think. I think that there was a neurodegenerative diseases research network, wasn't there, a few years back? But I think it's fine.
Yeah, that's morphed into something else, hasn't it?
Yeah.
I think if you're interested in a specific area, again, we plug the RSS on here because that's free, confidential advice to you. You can just go to them with I've got this idea for this sector that I'm interested in, not much research experience. What do you think? What are the opportunities out there? And they can help direct you to perhaps a researcher that's got specific experience in that area. But yeah, an internship's a great idea first to get you started, I think.
Okay, and I'm conscious of time, but I am going to press on with some of these questions because I can do the summing up reasonably quickly. So I'm interested in considering a career in research, but I currently work as a healthcare support worker with the NHS in Scotland. I also have a degree in sociology. Are there any entry points for me? So I would strongly suggest RSS. And also, if, for example, you were thinking about a particular scheme, then to carefully check out your eligibility in terms of both Scotland and your earlier degrees. So, for example, if you were going to do a PhD, it would be important to be sure both that the PhD was relevant to NIHR and to the university that you're interested in. But notwithstanding the fact that at the moment doctoral awards would not be supported in terms of NIHR if you live in Scotland. I think I'm correct in saying that. So the next one, guidelines. Oh, sorry, it jumps. So again, important to reach out to working in the field, but I know you've struggled with that. Maybe the starting point is research support service to see who could start to talk to you about some of those issues and about the gap that you've noticed. So this is a good question. Is there a distinction between social care research and community development work or research, and where do they align, if any? Paul, could I pass to you to respond to this one?
Thanks, Catherine. Yeah, I mean, community development work could be part of a research project, so there's no distinction in terms of methods. It just depends whether your project idea is within the social care sector, and it sounds like it is. So community development is a kind of part of research methods sometimes, get people around you, develop an idea, etc. A bit like the participatory methods that Mike was talking about. So don't think in terms of silos of methods and things that you want to explain. So get the support. I'd reach out to the RSS and say you've got an idea, if that's what you have, and see if you can develop it, certainly.
Okay, thanks for that, Paul. So I don't think I've missed any questions in the chat or any new questions in the Q&A. So I'm going to draw this to a close, but I've just a few things to say. Just to reiterate that you're not on your own. So even if you're thinking about applying for an individual fellowship, which will be your award, hosted by either your practice organisation or one of the universities, you're not doing it on your own. You need to gather around you that group of people to support you. And so it's really important to emphasise that. The other important thing to emphasise is that regardless of where you are on your pathway, that you will be able to find a scheme that is suitable for you. If there's any question mark about eligibility, contact NIHR and check that out first before you embark on an application. And really, before you embark on an application, you do need to have gathered that team around you. And keep going and keep making contact. Now, apparently I have missed some questions. Let's have a look. So I think Paul answered the one about social work research and community development. So that we've picked that one up, Humera. So unless I've missed another one, one of the things I was going to do is just ask each of our panel members and Paul just to say one thing about one key piece of advice that they would pass to someone. I'll go first, and that is I nearly gave up on my PhD. Like completely nearly destroyed the data. I'd had enough of it. It was all a bit grim. And a kind mentor said, keep going. And I did. And I kept going. So my bit of advice is, even if you need to pause for a while, keep going. Katie, could I pass to you?
Yeah, of course. And mine's mentor related as well. Pick your mentors really well. Pick the people who are going to develop the bits that you are not good at. Pick the people who are going to give it to you straight, because you don't need people telling you how great you are. You need people that are going to develop you. And if you're in a place where you really want to learn and stretch yourself, get those people around you. People that are well networked. Your mentoring team is so fundamental to how you're going to learn and grow in this space.
Thank you, Katie. Paul.
Hi, folks. Yeah, I was a social worker for many years, interested in research, but NIHR didn't exist when I was a social worker. There wasn't this infrastructure. There's loads of infrastructure now. So I'd say reach out to that infrastructure. It's free. There are people paid to help you on your research career from NIHR, both for projects and fellowships, etc., the academy, and once your project starts as the research delivery network. There's leads for social care, social work in all bits of the NIHR. So reach out. You're not on your own. Don't think you're on your own.
Thanks, Paul. Mike.
Yeah, I think everyone so far has covered the most important thing, which is about finding your friends and allies, building your networks. So I'll endorse that, but I'll add, just remember it's meant to be fun and interesting and energizing and exciting. You'll have lots and lots of frustrations along the way. You'll get over those, particularly if you've got the good support around you, and just focus on the fact that actually this is quite an energizing, exciting area of work to be in.
Thanks, Mike. Katrina.
Everyone kept stealing mine. Yeah, enjoy it. Find something you really enjoy. Get lots of feedback, and just start. Don't worry about perfection. It starts with imperfection, and you keep getting feedback till you get something fundable.
Yeah, No, that is really important to start and keep going and pause and keep going. I think there are some further questions that we've missed, and we have got a few minutes. A question about is there guidance in regards to which incubator is appropriate? The starting point, I would say, is a mental health social care incubator. It's quite a broad network that does overlap to some extent with the area that you're interested in terms of neurodivergence. So do start with the mental health social care incubator, and we will definitely be able to pass you on to people who've got similar interest. So I hope that's helpful. Just seeing if there are any other questions that have been missed. I mean, we've got a couple of minutes if anyone wants to put a final one in the Q&A. I mean, I'm conscious that there were a lot of slides that I went through, and I know that some of them I went through really quickly. And it was trying to strike that balance between providing lots of information to you and then also talking through some of the things that were important and the highlights. Please do go back to the slides and have a look. There are lots of links in them. But I know that it can all be a bit overwhelming, and making that first contact with somebody who knows a little bit more about it than you do, for example, a research support service, can make a massive difference. And don't see it as a one-shot thing that you contact somebody, you have your session with them, and that's it. The support is ongoing. I mean, I know that people that I have provided help and support to and mentoring sometimes disappear for a year and then come back and make progress. And there are examples of people keeping going, trying again, who have been successful with individual awards and fellowships, or have been successful with one of the grants. And I didn't spend very much time on the programs, different programs of research. There's obviously the research program for social care, which is key to social care research, and there's an early career scheme within it. So if you're an early career researcher, then a panel will focus on the early career research applications. But it's important to note that right across the different programmes, including the programme grant scheme, for example, which are really large pieces of work, social care is relevant. So it's not the social care funding, social care interest is not restricted to the research programme for social care. I think that's really important to note. So just to remind you, loads of support. Start early, don't give up, and hopefully some of you will get in contact with organisations that we've talked about that can be helpful to you. So thank you ever so much for coming, and keep in touch with the NIHR network. I mean, we all know each other on this panel, but each of us has got a really big network. Social care cuts right the way through the NIHR community, right across the UK, in fact. So good luck and keep in touch. Thank you.